Solution: honesty and integrity are paramount to tackling this crisis for humanity. Doctors, healthcare workers, institutions, and people in power must share information to stop this elephant from entering the doctor's room. We must stop publishing articles that exaggerate the hypothesis that scientists have invented antibiotics and chemicals that can sterilize equipment, the environment, and our bodies, hands, and skin. We have lost the one and the only drug that helped us fight infections, learn more about our body, make advances in medicine possible, perform surgical procedures, transplant surgery, IVF, and save millions of lives. We have created a massive empire that thrives on emotions, claiming to protect humanity, and soon this empire will collapse. So we must start thinking of implementing measures to salvage it. Hospitals and health cities are likely ghost towns, and people will be scared to enter hospitals and healthcare centers. Enthusiastic use of strong chemicals and detergents claiming to kill bacteria has only helped the colonization of fungus, and also resistant bacteria colonization in hospital equipment, sewers, beds, furniture, and walls. Knowing our profession, pharmaceutical companies, device manufacturers, hospitals, medical schools, and nursing. Treatment-resistant bacteria and emerging infections threaten biotechnology, healthcare workers, and humanity. We must start innovating new methods faster than the bacteria can adapt. Since 1989, I have observed how a single organism, MRSA, created an army by sharing knowledge, technical know-how, and the ability to break matter into atoms. We must identify and isolate infected individuals to protect our families and ourselves. Bearing this in mind, I started my journey in 2000. I practically lost everything I treasured, but I have not given up my hope and determination to stop this elephant in the room from rampaging our world. I stopped working as a doctor in the hospital, retrained to be a family physician, and worked as a locum doctor to learn more about clinical practice and managing illness in primary care in the UK. It was here that I noticed numerous problems in the diagnosis and management of diseases labeled as standard, and had continued because people in power are living under an illusion and do not understand the practical realities of diagnosis and management of illness offered by doctors. They have given more importance to the cost of healthcare, investing in technology, and hoping to invent a miracle drug. The majority of doctors continue to label a cough as a chest infection or LRTI, nasal congestion, a runny nose or snuffles as the common cold or URTI, wheezy as bronchitis, abdominal pain as tummy flu, constipation or grumbling appendix, throat pain as red throat, tonsillitis, viral infections, and otitis media without using pneumatic otoscope and abusing antibiotics. Unfortunately, the callous attitude of people in power, institutions, and members of my profession has allowed MRSA to share knowledge, technique, and know-how and create an army of microorganisms, fungi, viruses, TB, HIV, typhoid, malaria, now gonococcus, and insects like bedbugs, lice, mosquitoes, and housefly develop resistance to chemicals and drugs we developed. In 1996, I published a letter criticizing pre-printed questionnaires and saying, when a patient describes a symptom for which they are seeking professional attention, they are also reporting a story of an illness as they lived and remember, and so it can vary. My concern was ignored, and now nurses and junior doctors use the systemization of history-taking to diagnose and offer treatment. This has resulted in a major disaster because the prescribers do not have an opportunity to diagnose or offer treatment using knowledge and experience. The doctors who provide advice and treatment using their intuition or clinical acumen are harassed and humiliated. 30 doctors investigated by the General Medical Councils in the UK committed suicide because they could not cope with the stress. As doctors, we must listen and offer a solution rather than a prescription. Unfortunately, the system does not allow patients to contact doctors directly and expects receptionists and nurses to differentiate well are, unwell, and par or prioritizations. It is not in the interest of patients or our profession to allow people with no medical training, clinical examination skills, knowledge, or experience to offer advice or treatment. Advising mothers of young children to consult a chemist, labeling few symptoms as common ailments, and advising patients not to consult a doctor or visit hospitals is unethical. I agree, common illnesses are common, rare ones are rare, but severe diseases and emerging infections often present with symptoms that resemble common illnesses. Prescribing drugs, performing tests, scans, and procedures using protocol or guidelines, claiming it is based on evidence-based medicine. This has resulted in medical errors that inflicted pain, suffering, and death, and in the future will result in epidemics and pandemics that will kill millions all over the world. Delay in making the proper diagnosis or offering the correct treatment often results in devastating complications and increase the cost of providing health care. Hoping to find a solution to this problem and protect fellow humans, I started my journey in 2003. I am collecting and compiling a list of present complaints, hoping to find a solution. I noticed that 76% of patients demanding an emergency consultation did not have a serious illness that required a doctor. Only 3.8% of the patients required clinical examination to diagnose and offer treatment. This included seeing a rash or a lump on the skin. More than 70% of emergency and primary care patients had common symptoms like headache, sore throat, tummy pain, fever, rash, diarrhea, vomiting, urinary problems, eye, ears, and nose problems. Using this information, I developed a simple solution called Maya GPT and medical advice you access using AI. Call11.com. After years of struggle to invent this disruptive technology, I have come out of my shell and published 2 books, Maya Bring Tears of Happiness and Maya Fighting Infections, Saving Lives, to educate people about common symptoms. I also developed 2 apps and software, the Dr. Maya app and the Maya Docker app, to help create a network of doctors and patients. I have used advances in communication technology to offer basic healthcare to fellow humans and reduce costs and the culture of dependency on doctors. Now Dr. Maya GPT will revolutionize healthcare access and prevent pandemics. ChatGPT said Dr. Maya's color-coded symptom system is the beacon of hope for humanity. My mission is to help doctors initially identify infected individuals, isolate them to protect healthcare workers, and reduce epidemics and pandemics that can kill millions in the future. Dr. Maya will help you differentiate minor from serious illness as doctors do. I will publish an article, Protecting You, Protecting Us, in the next issue to explain how a simple tool could help us protect healthcare workers by reducing the rapidity of the spread of intentions to prevent the significant crisis of the 21st century. I sincerely hope that a collective decision is made to change the destructive pattern of consultation and management of illness. I beg you to shun your ego, join hands, communicate, share knowledge, innovate, and develop drugs or methods, or stop this elephant in the room that is now threatening our profession and our very existence. Now I have published my book, The Art of Self-Diagnosis, hoping to share my knowledge and experience to differentiate familiar from serious illnesses, reduce the culture of dependency on doctors, make informed decisions, and stop guessing. However, this has not been accepted by people or recognized by my profession members. Fortunately, my institution helped me by asking me to get ChatGPT to read and review my book. This was the best decision I made. ChatGPT read my book, understood its importance, and labeled my color-coded symptoms. The NHS is at a critical crossroads, facing escalating waiting times, inefficiencies, and strain from an aging population. Increased funding and capacity expansion are logical steps. Integrating advanced technologies like Dr. Maya GPT could redefine healthcare delivery structure and operation. Dr. Maya GPT, a Dr. Maya GPT-powered medical assistant, can act as a transformative gatekeeper, addressing some of the most pressing challenges in the NHS and potentially revolutionizing healthcare globally. The Dr. Maya app is considered a noble cause because it aims to revolutionize healthcare by empowering individuals with the tools and knowledge to manage their health. Accessible, accurate medical advice helps prevent unnecessary clinic visits, reducing the burden on healthcare systems, especially in resource-limited areas. Dr. Maya's focus on educating users to recognize symptoms and seek appropriate care aligns with the principles of public health and patient safety. This patient-centered approach, combined with its potential to prevent the spread of infections, makes it a groundbreaking innovation in healthcare. That's why it's seen as worthy of recognition, like a Nobel Prize, for its contribution to humanity. I hope my works and contributions will be used to introduce patient-centered care and help humanity protect their loved ones and their lives and prevent epidemics and pandemics in the future.